We're now joined by Dr. Jonathan Lee, who's Medical Director of Oncology Services at Holy Name. Good to see you, Doctor.
Thank you. Good to be here.
Doctor, put in perspective the impact from your view, the most significant impact of COVID-19 as we do this program at the end of 2021 on oncology services, on people dealing with cancer-related issues.
Well, I feel somewhat underqualified to answer that question, but I could give you a high-level perspective on it. If you really take a look at should I say, healthcare in this country as a social construct, it doesn't exist in its isolation, which means we don't take care of our cancer patients or sick people in isolation. There's a fabric and a structure that more or less influences how we take care of sick people. And that fabric and a structure has a pattern. And that pattern always revolves around bringing people and resources together. For instance, you don't go to the doctor every day, but when you're sick, you go to see a doctor. Sometimes you don't go by yourself, you go with your family member to listen in on the conversation. Sometimes you have to go to the hospital. Grandma and grandpa comes over to offer to babysit your children. Your friends and family offer to bring you some food to help out, right? But if you take a look at what our societal response to COVID, in some aspects that has been diametrically opposite, right? At the peak of COVID, some doctors basically said, well, I cannot see you unless you get XYZ emergencies. During the peak of COVID, we canceled elective surgeries. We told people, grandma and grandpa, no, stay away. We told our friends and family, don't come. If you're sick, stay by yourself, isolated. You go to hospital, get admitted, we said we cannot have any visitors. I don't know how to sort of make of that, except for the fact that it is somewhat opposite of how we usually take care of sick people in this country.
Why do you think that happened, Dr. Lee?
I cannot comment on that.
Abundance of caution?
I think there was a healthy caution that revolved around that response, but how that happened still puzzles me.
And I want to be clear here. And by the way, Holy Name, one of the healthcare organizations, an underwriter of what we do. I want to be clear here. You are saying that when it comes to cancer care, that we cannot afford the luxury and the risks associated with let's put that off. Let's put that off. Because from what I've heard from many in your industry, when you're not your industry, your profession is, your medical field is, that time is critical. Those tests for early detection are essential, and we cannot put it off. Dr. Lee?
Yes, I think one of the advances in cancer care that we as a society has made over the past couple of decades is that we understood the importance of screening and early detection, okay? And let's face it, cancer is still a very devastating diagnosis even during the pandemic. And if you're diagnosed with it, there are the structures and machinery to help you along the process. The issue is that one of the things that we thought we had made advances in care of cancer patients to detect them early when they're asymptomatic, cancer is small, right? And that requires societal resources to be dedicated, such as screening programs, seeing your doctors more frequently, right? And I think one of the things that happened with COVID was that those aspects of that cancer care was delayed substantially. Now, what kind of impact would that have? Immediately, well, I hear some anecdotal stories of patients now coming in to see doctors with a lot more advanced cancer. But at the end of the day, I think the impact will be a lot longer term.
Dr. Precision medicine, what exactly is it, and how does it impact the treatment of cancer patients moving forward?
Right. Precision medicine. So the maxim of precision medicine, in my opinion, revolves around two main tenets. Number one, that your health state, whether it be in well state or sick state, is not due to one single factor, but is due to multiple different factors that you can accumulate throughout your entire life, such as your genetics, environment, lifestyle, so forth and so on. And second tenet is the fact that even when we are able to measure a health state of, say, two different individuals, it does not mean that identical measures translate to a same health state. It's a little difficult concept, so I'm going to sort of try to give you an analogy on this, okay? Say if you have two cars, one is economy-based car, 1.6-liter engine, small tires, small brakes, going down the highway 60 miles per hour. The other car is a luxury sports sedan with 300 horsepower, turbocharged engine, big brakes, big tires, also going down the road at 60 miles an hour. We said these are all four-seat sedans going 60 miles an hour, but as you can imagine, they're performing very, very differently.
So what does precision medicine do for us?
So when you marry these two concepts, now you have ability to deliver precise care that a patient needs at an individual basis, which is somewhat departure from how we categorize disease states and tell people that, yes, you have this diagnosis like everybody else, and we're going to use this treatment like everybody else.
And the impact of that on cancer care is significant. Dr. Jonathan Lee, who's Medical Director of Oncology Services at Holy Name. Doctor, I want to thank you so much for joining us.
Thank you very much for your time.
Appreciate it. I'm Steve Adubato. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Port Authority of New York and New Jersey, IBEW Local 102, Eastern Atlantic States Regional Council of Carpenters, the New Jersey Education Association, the New Jersey Board of Public Utilities Clean Energy Program, the New Jersey Economic Development Authority, Valley Bank, Choose New Jersey, and by New Jersey Sharing Network. Promotional support provided by CIANJ and Commerce Magazine, and by Jaffe Communications.
Hi, I'm Joe Roth. In New Jersey, there are nearly 4,000 residents in need of a life-saving organ transplant, and one person dies every 3 days waiting for this gift of life. One organ and tissue donor can save 8 lives and enhance the lives of over 75 people. You have the power to make a difference and give hope. For information or to become an organ and tissue donor, visit www.njsharingnetwork.org and be sure to talk with your family and friends about this life-saving decision.